Did you know there are many reasons your child could be coughing and it's not even due to a viral cold? I'm Dr. Nkeiruka. I'm a pediatrician and pediatric ER doctor, and in this video, I'm going to be talking to you about 9 reasons your child may be coughing persistently. Knowing these multiple causes of persistent cough can help you talk to your regular provider and make sure your child is getting the treatment they actually need. A viral cough is the most common reason kids may cough. There are about 200 plus viruses, even though the most common ones are the rhinoanero, RSV, and the flu. A viral cough and illness typically lasts about a couple of days to a week, but because kids are in schools and mixed with other kids, even though they're battling with one virus, they may pick up another one from a friend, and it tends to prolong their course and makes them seem like they've been sick for a couple of weeks. Pneumonias in kids may manifest as persistent cough, fevers, and difficulty breathing, and in some other kids, they may complain about belly pain. Pneumonias in kids can be diagnosed by examining and listening to your child, and then also by obtaining a chest x-ray to see if there's any evidence of pneumonia in it. Bacterial pneumonia is required to be treated with antibiotics, but some other kids may require support, especially if they're struggling to breathe. Number 3, rhinosinusitis. This is not very classic or easily diagnosed in kids because 1, their sinuses are not all fully developed yet, and then 2, kids don't usually know how to complain or express their symptoms. Sinusitis can be suspected in kids if they have a prolonged course of chronic nasal drainage, lingering cough, fevers, facial pain such as pain over the sinus areas, or even persistent headaches. Sinusitis needs treatment with antibiotics. Number 4, asthma. This is usually forgotten or less recognized, especially in a child who has never had an actual asthma attack. But it should be considered a child who has nighttime cough during or after exercises, especially in a family who has had a strong family history of asthma, and in a child who has eczema. Parents may also hear audible wheezing sounds, or your doctor may listen with their stethoscope and hear your child wheezing. A trial of albuterol may be considered in those scenarios. Number 5, allergies. In most kids and adults, this may manifest only as eye itching, sneezing, or itching around the nose, but in some kids, it may also manifest as persistent cough. This may manifest mostly at night when they lay down at night, when the bedsheet has fallen, or any other triggers that trigger their allergy symptoms. A trial of allergy medications recommended by their doctor may actually help with the symptoms. Number 6, swallowed objects. This may be more common in younger kids who still have a hand-to-mouth behavior. Young kids may choke and subsequently aspirate on food or non-food items. This may find its way down to the lungs and plug one part of the airways and cause persistent coughing and subsequent symptoms. Nuts and popcorn are 2 common foods that are likely to predispose kids to choking and aspiration. For a more comprehensive video, watch this video here where I talk about 6 foods that might be choking risk for kids. If a swallowed or aspirated object is causing persistent cough, we may be able to diagnose this on X-ray, and these usually need to be removed. Number 7, postnasal drip. This usually happens during or just after a recent illness. All the multiple secretions that's been produced by the body can drain to the back of the throat and causes irritation, especially when a child or an adult is laying down at night to sleep. So you may notice your child coughing more at night when they lay down, or you may notice them having some lip smacking or throat smacking movement because they're trying to move around the secretions. Honey has been found to be very helpful in cough, not only in cough, but also significantly helpful in postnasal drip. In some scenarios, steroid spray may also be helpful in resolving postnasal drip. Number 8 is more common in babies or kids who have swallowing problems, and this is reflux or swallowing problems. When babies are younger who have reflux or kids who have swallowing problems, they may have some fluid from the mouth, the feeding tube, going into the breathing tube and end up in the lungs. This can cause what we call cases of aspiration pneumonia, or may also cause some irritation that makes them persistently cough. This type of cough may be more related to feeding or when they have spit-ups from reflux episodes. It may be diagnosed based on history, or in some cases they may require a swallow study. And finally, number 9 is habitual cough. Just as the name sounds, this is a cough that has grown out of habit. It may have started as a viral illness when a child continues to cough, and even after the virus has resolved, your child just continues to cough. You may notice it differently because it allows them to sleep at night, doesn't bother them in most scenarios, and they may just cough when they see you or a parent or a loved one around. I hope this has been helpful for you and your doctor in exploring options while your child may be coughing persistently. When it comes to viral coughs, habitual coughs, and postnasal drip, I am Team Honey for kids who are older than 12 months old because honey helps much better than over-the-counter cough medicines. Leave me a comment in the comment section. Tell me your experiences about prolonged cough in your child. Don't forget to leave a like and subscribe, and I will continue to make more videos, and I will see you in the next video.